Hello, my name is Leanne Bell, and this is Nursing 4580 Synthesis of Professional Nursing, the Capstone 5-Year Plan and Presentation. Nursing is my second career. My degrees prior to going into the nursing field are a Bachelor of Science in Political Science and then a Master of Urban and Regional Planning. I wrote grants and did project management for the Texas A&M Transportation Institute for 8 years before I got my nursing degree. The reason I chose nursing is because urban and regional planning is not big in College Station. So it was difficult for me to get a job. And then I kind of mastered the grant writing portion, so I was able to get a job with Texas A&M Transportation Institute, and I wrote grants for them successfully. And then I managed those grants, including the budgets and all the activities that went along with it. But that also came with limited places to go. It was hard if I were to move to New Mexico or California or New Jersey. It would be hard for me to find a job like I had at Texas Transportation Institute. So I decided back in 2012 that I needed to further my education and get something to where I could use it um, and have unlimited possibilities. And I felt like nursing was that choice at the time for me to go into. So when I started my nursing, I went to telemetry and I had 12-hour shifts, and it was really difficult for me because I had um, twins are my youngest, and then I have an older child, but it was hard to keep up with the twins and do the 12 hours. And so I found an operating room position that did 6 a.m. to 3 p.m. And I was given the opportunity to try that out, and it has been my passion. And I am on a cardiovascular team, and we do hearts. And so I take about 15 days of call a month, but I absolutely love what I do. So as part of my job employment with the hospital that I'm employed, they have magnet status, so I have to get my bachelor's degree within a certain time frame. So that is my main reason for coming to Lamar University to get my bachelor's degree in nursing. So in this program, there are some learning outcomes that nursing students had to meet in order to get their nursing degree. And we're going to go over those learning outcomes now on the following slides. So humanity and society. So the program outcomes I felt were met, at least through these 3 courses. Humanity and Society is investigating populations in the community and exploring the holistic needs in the community. The first one, the assignment, Shadow Health Systems Assessment. So this was a program that we had to buy. It was $99, and it gave us a patient, and we had to ask the patient information and figure out what was wrong with the patient and how we would treat that patient. This was actually, I felt like, a great program. The only negative to the program was that the responses were limited. So you couldn't ask just any question and get a response. Sometimes it would tell you like the same answer, or it would give you a message that said, ask another question, or that question is not in the database, or something like that. That was the only con to that, but I felt like the Shadow Health program was a really good program on how to ask questions on health assessment. the Practice Leadership Management Healthcare System course with the Global Health PowerPoint presentation. That was something where we looked into an organization and we had to see how uh, they went about doing things and how you get involved with that organization on a global scale. And if you had to be in this organization, what would you do, or what would you have to do to be part of that organization? And since I worked in the operating room, I did certified nurse anesthetist, because if I were to do something else to further my degree, that's the next education that I would get. And then for practice care of communities, we had to do a windshield survey. And this was a monster of a project. We had to go out into the community. We had to explore resources. We had to pick a population. We had to go to the census website and find our land tracts and who lived there. We had to talk to people in the community. And by the time I was done with this project, it was like 17 pages long. And it was crazy. But it covered a lot of information as far as researching in communities and your society and what they live and what are some of the things that you have to account for, like disasters and children, and where would you evacuate from and what resources are in there. So I felt like all these encompass that humanity and society learning outcome. The next one is lifespan health and health continuum. And so the two projects that we had were, again, the Shadow Health System, which this is a great program. I'm just going to say it again. So the Lifespan Health Continuum evaluates and examines compromised health states. So again, the Shadow Health, we looked at different diseases and how to do your assessments to diagnose the patient. And then your Nursing 4620, your Practicum Reflections, well, those had to do with interviewing people with a compromised health state. And the neighbor across the street actually has stage 4 cancer that started at the breast and then metastasized to her back and then her brain. And so that is who I did my practicum reflections on. So I felt like those two projects encompassed the lifespan health continuum. The next one, evidence-based practice and clinical reasoning. So this helps you comprehend the research process, interpret evidence-based practices, apply clinical reasoning and judgment. So the three courses I put are from Nursing 4620, 4550, and 4390. So the first one we did, we analyzed literature, evidence-based practice related to chronic conditions, and we developed goals and nursing interventions. Nursing 4550, we did clinical application assignment, which we identified problems in current clinical settings and opportunities to improve those problems. The last one was a quantitative research article. I did mine on hand washing, and we had to use evidence-based research and practice. Patient client-centered care was the learning objective, was to demonstrate teaching, health promotion, and investigate theories. Those assignments for Nursing 4620, it was practicum assignments, and we investigated resources for health conditions, discussed and developed goals to measure strategies to teach patients, and we advocated for people using nursing theories. The next one, we did a disaster planning teaching plan and video practicum assignment, which we did using our windshield community population, which mine was children, and it was evacuating for hazardous weather. The last one was philosophy paper, and we examined theories that influence nursing care. Professional roles, that is coordinating care as a healthcare team member, coordinating care for patients, families in the community, and discussing patient advocacy, practice care within legal, ethical, and regulatory parameters. Those three nursing assignments you see, the differentiated essential competencies paper, and then in the next one, 4316, we use the Shadow Health Program to demonstrate knowledge of the professional nurse role while performing a health assessment. And then the last one, Nursing 4550, we did a effective leadership and qualities paper, which examined leadership skills and philosophy. Lastly, my 5-year plan is to continue in the operating room on the cardiovascular team because it's where my heart is. One of my goals is I can scrub during like a bypass surgery. I can scrub the leg to take the vein, but I don't actually do the chest. So my goal is to actually strengthen my scrub skills so that I can help assist the surgeons better. What I do have right now is I have an unencumbered nursing license. I have my BLS, ACLS, and I am CNOR. And that is the end of my presentation. Thank you.